Using a manual sphygmomanometer, aneroid, this type requires a stethoscope and a manual pump to inflate the cuff. Steps: 1. Prepare the patient. Ensure the person is sitting comfortably, with their back supported, feet flat on the floor, and arm resting at heart level. The person should not have exercised, consumed caffeine, or smoked for at least 30 minutes before taking the measurement. Have the person relax for a few minutes to get an accurate reading. 2. Position the cuff. Place the blood pressure cuff around the upper arm, about 1 inch (2.5 centimeters) above the elbow. The cuff should be snug but not too tight. Make sure the artery marker, a line or arrow on the cuff, aligns with the brachial artery, the artery in the upper arm. This is typically located on the inner side of the elbow. 3. Locate the pulse. Use your stethoscope to find the brachial pulse. Place the stethoscope bell, the round part, over the area just below the cuff, where the pulse is strongest, typically on the inside of the elbow. 4. Inflate the cuff. Close the valve on the inflation bulb and begin squeezing the bulb to inflate the cuff. Inflate it to around 180–200 mm of mercury, or until the pulse is no longer audible, or about 30 to 40 mmHg higher than the point where the pulse disappears. 5. Deflate the cuff and listen. Slowly open the valve to begin deflating the cuff. Listen carefully for the Korotkoff sounds. The first sound you hear as you release air is the systolic pressure, the higher number, which indicates the pressure when your heart beats. The last sound you hear, just before the sound disappears, is the diastolic pressure, the lower number, indicating the pressure when your heart is at rest. 6. Read the results. The systolic pressure is the point at which the first pulse sound appears, and the diastolic pressure is where the sound disappears. Record the reading as systolic, diastolic, such as 120/80ths of a millimeter of mercury, millimeters of mercury. 7. Repeat the measurement. It's a good idea to take at least 2 measurements for accuracy. If there's a significant difference, you can take a third reading and average them. 8. Turn off the cuff. Completely deflate the cuff by turning the valve counterclockwise to release the air. Remove the cuff and clean your stethoscope and equipment.